Hi, this is Dr. Padda, and I want to talk about a little bit about sleep and hygiene and how it's important, especially for pain patients. So the purpose of sleep is to help restore your body. It allows you to consolidate memory. It allows you to restore the endocrine functions of your body. It allows you to have improved insulin sensitivity. It reduces your level or risk of diabetes and obesity and all of those things. And the thing is that if we sleep deprive you, even 20, 30 minutes, even an hour, it dramatically increases your risk of cardiovascular disease. It increases your risk of death. And so what we want to do is make certain that we've optimized your sleep pattern. We want to make sure that you're getting restorative sleep. And sometimes patients go, well, if I take this sleep medication, they're put onto Ambien or Lunesta or Xanax or Valium, I think I'm getting sleep, and so I'm okay. The reality is that's not true. You're not getting restorative sleep. You're not getting the appropriate REM sleep that you really need. What you've done is you've essentially forgotten that you didn't sleep, and you've become dependent on a benzodiazepine, and that benzodiazepine is a potent drug, and it's really hard to get off of benzos. The reality is that a lot of our anxiety and a lot of our lack of sleep comes from a gut dysfunction. And there are bacteria in our gut that process amino acids and they process proteins and things of that nature. And they produce something called GABA aminobutyric acid, or GABA, that they break down the proteins and they allow the GABA to be there. GABA is an inhibitory neurotransmitter. It allows us to calm down our nervous system. And when we don't have enough GABA and we're irritated, or if we have too much glutamate, which is an excitatory neurotransmitter, we're irritated, and that prevents us from appropriate restorative sleep. So a lot of times, in place of the prescription sleep medications, we typically use things like theanine, and we typically use things like GABA supplementation with a little bit of magnesium to help. And then I've had patients go, well, Dr. Padda, I'm going to use some melatonin. And I have to tell you that I prefer that patients not use melatonin. There really have not been good studies done in higher dose melatonin. And by higher dose, I mean greater than 1 milligram. Most of the melatonin that's over the counter is 5 milligram, 10 milligram. And there have not been good studies done on that. Melatonin is a potent endocrine disruptor when you get to higher and higher dosages. And it has a whole host of other problems not related to sleep. And you also can get a paradoxical effect. You can actually, the longer you're on melatonin, the less it becomes effective, and sometimes it becomes excitatory. So I try to wean my patients off the benzos. I try to wean them off the melatonin. And if we're going to use a supplementation, we typically will go toward a GABA supplement, and we'll add some magnesium and things of that nature. But we really want to avoid these potent benzodiazepines. I also want to talk a little bit about blue light and melatonin. And I know I've addressed this in another presentation, but I want you to focus in on it. If you're having blue light exposure, and you're having blue light exposure within an hour, even up to 2 hours of sleep, it's going to disrupt your sleep. It's going to do a couple things. One, it's going to prevent the release of your naturally occurring melatonin from your brain, and you need that to synchronize all of the endocrine system and all of the cellular circadian rhythms that you have in your body. And if you don't have the release of natural melatonin in the dosage that it's supposed to be, then you don't synchronize and you don't get restorative sleep. The other thing is that having a television in the room, looking at that TV an hour or two before you sleep, your brain can't differentiate between the television and its own dreamlike state. And so it thinks it's already dreaming. It thinks it's already half asleep, and it's intercalating those images right into your dream cycle, and it's not going to give you good restorative sleep. So what I try to do is encourage my patients to completely avoid TV for at least an hour or two before bed. I tell them to put down any of their devices that generate blue light. I try to get them to quit doom scrolling on their phone, to quit the TikTok, to quit all of those other things at least an hour or two before bed. The goal of this is to create a routine. What you want to do is know that you're going to go to bed at a certain time. Plan that you can get 7-8 hours of sleep. Even in an adult, they need between 7 and 8 hours of sleep. You want that room to be dark. you want it to be cold, you want to have some background noise, and you want the sleep-wake and the sleep cycle to be very consistent. Your body needs to get into a routine that, hey, at this time of night, I kind of wind down. This is what I do before I go to bed. I use sleep personally as a way to solve issues, to solve problems, and to make considerations of the next day. I always give myself the issue that I want to look at for the next day. I give myself an opportunity to work through those things in my dream state, and that really benefits me. Everybody's a little bit different. You can use your dream state to do whatever you need to do to help you restore for your future. But that dream state is not completely unconscious. That dream state is actually a problem-solving state for your brain. And when you use benzodiazepines, you're pretty much becoming unconscious. You're missing about a third of your life if you're using benzodiazepines to quiet everything down. And so I don't want to use sedative hypnotics. I don't want to use anesthetic agents on my brain because it's not going to give me a third of my life. And I want to avoid that. If you want additional information, we've got a checklist on improving sleep. Please feel free to download that. And if you have any questions, ask me. I'm happy to answer them. And if you're one of our patients directly, then we'll see you in person and talk about it. But this gives us a context to have a discussion so that everybody knows where we need to head and what we need to do. Thanks so much.